Hello and welcome. This is Jamie. I have Larry here with me today. We are with PEBB's Outreach and Training Unit, and we'll be hosting today's webinar together.
The time to come to our 2021 pre-open enrollment webinar, and this is one for higher education. We will do 3 webinars here in October. One is for the state agency, we did on October 5th. Let you know that's already posted on the PERS Pay website out there for people to take a look at. And as soon as we're done with this one, we're going to post one for higher ed out there also. And on the 19th, we're going to have the one for the PEBB employer group. On the agenda today, we're going to talk about general open enrollment information, medical plan changes, premiums, dental, life, AD&D, and LTD, medical FSA and DCAP. We'll have a break at that time. Then Jamie will talk after that. She'll talk about the 2020 rule changes, worksheets updates, and reminders for you. All right, open enrollment information first. As in the past, open enrollment is for the month of November 1st through the 30th. Just let you know, the forms will not be ready until November 1st. So don't use 2020 forms in place of the 2021 forms. Again, make sure the signature date is not prior to November 1st. Again, it must be on a 2020 enrollment form. And all changes are going to take effect January 1st, 2021. This year is going to be a little bit different. Usually we do in-person benefit fairs, but this year we will not be doing in-person benefit fairs. What are we going to do to replace that? We're going to have online virtual benefit fairs, again, available 24 hours a day, 7 days a week. What are these benefit fairs going to provide for you? Benefit options and plan availability, plan comparisons, informative videos, and webinars. For more information about that, you want to go to the link here. Jamie and I went out there today, make sure it's out there. So I haven't personally went and looked at it, but I heard it's very good. So again, benefit fairs will not take place here due to COVID-19. We also will be doing a Facebook Live event. We're going to let employees learn more about plan changes, getting answers, and more. In order to join an event, again, it's going to be on October 14th at 4 p.m. And here's the Facebook link for the Healthcare Authority. Again, you want to visit the PEBB Open Enrollment webpage for more information. How do we communicate with the employees? Again, we have the For You Benefit newsletter, which will be mailed in October here. Again, we have one for state agencies and higher education institutions and one for employer groups. You'll get the one for state and higher education institutions. Again, this is the only notice we send out for open enrollment. Additionally, more information will be provided there, including notice of credible prescription drug coverage and summary of benefits and coverage notice. So additional information will be those newsletters for employees to read. Have you signed up for Gov Delivery? Very important to do that, so you get the communications that we provide to you for open enrollment. We're going to include that and send an email message to you to forward to your employees. So again, already a pre-written email message. All you do is going to forward this to your employee to tell them about open enrollment. Again, it'll be sent before and throughout the open enrollment period. So you'll get some before and throughout open enrollment. Again, in order to receive these messages, you must be registered for Gov Delivery. How do you do that? You want to go to the PERS Pay website. You're going to look on the left-hand side under Toolbox. You see on our toolbox here, sign up for outreach and training messages. Here's the registration part of it there. So again, go to the PERS Pay website, look under Toolbox, and sign up for those messages on the PERS Pay website. What can employees do during open enrollment? Again, the first thing to do is change their medical and dental plans. They can enroll in PEBB Medical without proof of loss of previously waived. So again, Outside of open enrollment, in order to waive your coverage or make changes, they require proof. During open enrollment, you can enroll in that medical coverage without proof of loss. They can waive medical, but the only way they can make medical is if they have TRICARE they can enroll with, Medicare, or other employer-based group medical. Any other reason besides these here, including the health benefits change, they should not be waiving medical. What else can employees do? They can add eligible dependents without proof of loss, but they must provide dependent verification in order to do that. So again, by the end of November, not only must you enroll these dependents, they must provide dependent verification in order to enroll these dependents. You want a list of valid DV documents that are available on the PEBB website for you. You can also remove dependents to medical and or dental plans. You can change a premium deduction to pre or post-tax, IRC section 125. You could also change the tax status of a dependent, IRC section 152. What changes can be made? You can use either form or online to do that. Again, through the form section, you could do everything in there. But through the online section, in order to add dependent, you must complete that form and provide a dependent verification before November 30th. So again, you can add dependent to medical or dental, change the medical dental plans, remove a dependent from medical or dental. You can waive enrollment in medical. You can enroll in medical previously waived, and you could test to the spousal surcharge. Again, UW employees must use Workday to make their changes. On the very bottom there, also the premium deduction, the pre or post tax, again, form online there in order to change that deduction for you. This year, we're going to have updated forms, so there's going to be changes to the form a little bit. Again, they were noted in the September 4-year benefits newsletter. There will be an optional gender identity field added there. Again, male, female, or X. The sex field has been renamed to sex assigned at birth. And in the bottom page, the employee section used to be the bottom of the first page, has been moved to page 10. Again, the employer section where you feed the eligibility date, start date of coverage, used to be on the bottom of page 1, is now going to be on page 10. Yeah, the form will also be available online in fillable PDF format. They'll be located in the Forms and Publications section of the PEBB and PERS-Pay websites. Here's a look at the form. You'll see under the subscriber section. And the gender identity part here, again, male, female, or X here. Also, PEBB Program My Account. Again, employees can make certain changes online during open enrollment. And you can use on my account, either online or mobile access to my account. Really, 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 really important is that if they do an online account and make changes, they want to either make a screenshot or print a confirmation of the changes. Again, save a screenshot or print a copy confirmation. A lot of times people go through most of it, then don't finish the rest of it, and they don't actually complete the process. So again, we ask people to go through the whole process, save a screenshot or print a confirmation of the changes. Again, another reminder, University of Washington employees must use Workday to make their changes. PEBB My Account. What else can I use my account for? Again, they can use the coverages for medical or dental, basic life and AD&D insurance coverage. Remember, supplemental life and AD insurance available through MetLife's My Benefits portal. They also can view their basic and supplemental long-term disability insurance through my account. And I think higher ed, they think that, I don't know if they can actually do that through my account because we don't use they don't use our screens there. So again, I'm not sure about that one. Jamie, do you know about that one?
Hey Larry, sorry, I'm answering some questions
That's
on my
okay.
end.
My fault.
What was the question?
The question was, through my account, because higher ed doesn't use our 45 and 46 screens, can they view the supplemental LTD on my account?
That is a really great question. I'm not sure. I'd have to pull up the manual and I will attempt to do that before we.
That's okay. We'll get back to them with the answer to that question. I believe you can, but maybe
Okay.
they made some changes there, but we'll get back to them. All right, thank you, Jamie. So again, here you can also subscribe to email notifications from PEBB. So like for myself, they notify me when the newsletter is available. And I go right online, they send a link there, and I get email notifications from PEBB. They can also print off a statement of insurance. But remember though, the statement of insurance will only display the current information. Any change they make during open enrollment will not be displayed until the change is effective, so after January 1st. Also there too, my account, you can look at tobacco use premium surcharge, which is available all year. So guess any family member age 13 and older has a change in tobacco status. You can make changes to your surcharge question all year long. Also, the spouse, the state registered domestic partner premium surcharge is only available November 1st to December 31st. So those are the only months that you can actually go online and make changes to the surcharge for the spouse. Again, only available through 1st November through the December 31st. What can I not use my account for? Again, adding independents not currently enrolled in medical or dental. Address change, you cannot make an address change through my account. You want to make sure that address change is submitted to your employer. They also should not use my account during open enrollment to remove a spouse or state registered domestic partner due to divorce or dissolution of the partnership. And the very reason is that a COBRA packet will not be sent if the dependent is removed online. So again, to make sure they get that COBRA packet, they want to submit a form to remove that spouse or domestic partner due to divorce or dissolution of a partnership. Also, too, they can make use of my account to make changes for life or LTD changes, elect FSA or DCAP enrollment, or change your HSA contributions. So when you go to the PEBB website, look under the employees section, look up to the top right, you'll see the link for my account in green up to the top right there. Once I log into my account, again, if I want to print off a statement of insurance, you can see at the top right there, the little green button there, you can print off a statement of insurance. Also, if you have access to Pay One, not only can you print off a statement of insurance for yourself, you can also print off statement of insurance for your employees. Okay, what you want to do here, you see the top there, subscriber SOI lookup. The testation report there is also going to be there for. So again, you can either do a statement of insurance or look at employees who need to attest to the surcharge over the open enrollment. So again, both things are available to you if you have access to Pay One. One more thing before I forget this, for people who don't have access to Pay One and maybe want that information, I think we can go in there and send you the links for those. We really want employees to go out there and make their own statement of insurance. But if you want that report to see who needs to attest, just send an email through the Fuse and we can get that report for you. All right, for the changes that were made online, again, it's submitted to Pay One Daily. How do we share those changes with you? For our four-year institutions, we had a daily trialogue or file from HCA. For our community and technical colleges, we're going to share a report with you in mid-December. All right, medical plan changes for 2021. For Kaiser, Northwest, and Kaiser WA. Again, they're going to be one hearing instrument per year, every 5 years at no cost. This is really all the plans across the board though. One reminder, if you enroll in the high deductible plans, the deductible must be met first. Also too, providers may not balance bill you for the service. So again, as long as they're a provider with this network of doctors, they cannot balance bill you for the service. For uniform medical plan, this is all plans across the board, we have a new plan selection for 2021. It's called UMP Select. It'll have the same network of providers as UMP Classic or the high deductible plan, the CDHP plan. Also too here, got the one cover, one hearing expert per year, every 5 years at no cost. Also too, if you enroll the high deductible plan, your deductible must be met first. And just like Kaiser, they cannot balance bill you for the service. Another change, very important, is the vision service, vision coverage. Again, this year, 2021, will be offered through VSP providers, Vision Service Plan. Your providers will be the VSP Choice network of providers. So again, for more information about the UMP Select, the hearing aids or hearing instrument per ear, and then also to the vision coverage, please go to the website, have you and your employees go out there and read up on it to make sure they understand these new benefits. For UMP Plus plan, the Pure Sound High Value Network. Again, we adding counties to a service area. Okay, so for 2020, we're gonna add Chelan County and Douglas County to the Pure Sound High Value Network. Also, they're gonna add the following provider groups to the network: Confluence Health Clinic and Everett Clinic. So again, new counties, new provider groups to the Pure Sound High Value Network. All right, a CDHP plan, Consumer Directed Health Plan with a health savings account. The employer contribution will remain the same for 2021. Again, for subscriber only, it'll be that $58.34 per month for a total of $708 per year. And subscriber one or more enrolled dependents will remain the same for 2021, $116.67 per month, or $1,404 per year. The contributions IRS sets are going to change just a little bit for 2021. For subscriber, this year was $3,550. For 2021, it'll go $3,600. If you have a subscriber enrolled with one or more enrolled dependents, then it was $7,100 for 2020. It goes to $7,200 for 2021. As in every other year, if employees age 55 and older, they contribute additional $1,000 per year to that HSA account. Very bottom of the screen, I want to make note of this. For the employee contribution and wellness incentive, if earned, may not exceed the IRS maximum. As far as the contributions amounts, again, using the employee authorization for payroll deduction to the health savings account form to changes to your contributions at any time during the year. All right, Smart Health. So the $125 Smart Health Wellness Incentive remains for 2021. The deadlines remain the same too. For employees that have effective date from January 1st to September 20, 2021, their deadline is November 30th. For subscribers with effective date October to December 2021, their deadline is December 31st, 2021. Guess what? The gift card is coming back. Remain for 2021. Again, it's awarded for completing the well-being assessment between January 1st to December 1st, 2021. And also too, email employees will be sent to employees once they complete the well-being assessment. If you do not want the gift card, do not click on the link. Again, once the email is sent to employee, if they say, I don't want this, again, don't click on the link. If you do that, you will have the gift card. And remember, the gift card is considered taxable income. The employer is going to receive like a monthly list of employees who received or earned the card, and employers must report the $25 on a W-2. All right, premiums. Here's a list of the premiums for 2020 and 2021. The top two, you talk about the KP Northwest Classic and the CDHP program. The middle four there, the KP Washington Classic, high deductible plan, sound choice, and the value plan. Again, difference between 2020 and 2021. And the bottom section is UMP. You got the Classic, the Select plan, the CDHP plan, and the Plus plans. And these are the premiums for 2020 and 2021. All right, dental, life, AD&D, and long-term disability. These are the same plans for 2021. So again, no changes for dental there. We got the uniform dental plan, Delta Care, and Willamette. Our PPO plan is uniform. We have two managed dental plans, Delta Care and Willamette. Again, no changes to dental benefits for 2021. Really, really friendly reminder, Delta Dental administers two plans, Uniform Dental Plan and Delta Care. A lot of times people say, yeah, I want Delta Care, and really mean Delta Dental and sign up for the Delta Care plan. One thing you want to do is make sure they're signing for Willamette or Delta Care is call the plan or go online to make sure your dentist participates in the plan. Okay, so again, Uniform Dental Plan, Delta Care is administered by Delta Dental. A lot of times people say Delta Dental, think Delta Care. And if you see that, you might want to question it if you have time to do that, I know. You might want to question to make sure they sign up for the right plan. Again, employees want to contact the plan directly to make sure the dentist participates in the plan. For more information about that, again, visit the Contact the Plan selection on the PEBB website. Long-term disability. So now we're going to have a telephone access to file claims coming January 1st, 2020. Again, you want to contact Standards Service Center, 800-368-2860. Again, it'll be available Monday through Friday, 5 a.m. to 5 p.m. Pacific time. Again, coming January 1st, 2020. Again, employer statement information for calling claims requested via email. Please, 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 if you have a different contact for your agency, you want to make sure they were updated through the PERS Pay website there. Sorry, PERS Pay email address must update. So again, if you have a new contact for your insurance or your benefits, you want to make sure you send it through Fuse to update your existing contact information or add a new or secondary contact. Please send that request to the Fuse in order to update those addresses. Here's kind of look at some frequently asked questions. Again, it'll be available on the PEBB and PERS Pay website.
Hey, Larry.
Yeah, sorry.
Oh, no, you're fine. We did receive a response actually from the audience on that question about whether or not supplemental LTD was visible via PEBB My account.
Yes.
Yes, and oh, it just moved on me. 1 second. I know, sorry about that. They said they can't see optional LTD. My account only shows the basic coverage.
That's what I thought.
Okay.
Just want to make sure that something that changed. I just want to make sure that it is out there. I make sure people know about it.
Yeah, of course, of course. So hopefully everybody caught that. Thanks.
Thanks, Jamie. I appreciate that. All right, for life insurance, this is different, guys. Doesn't happen often. But again, for supplemental life insurance, it'll be a one-time enrollment window during the annual open enrollment. I've always said, hey, they don't do it during open enrollment, but this year they're going to do it. Again, eligible employees can enroll or increase supplemental life insurance coverage from November 1st to November 30th. They can elect up to $1 million in coverage for the employee. And the EOI only requires 5 questions. If they answer yes to any of those questions, they have to go through the regular process in order to add or enroll or increase the supplemental life insurance coverage. Again, contact MetLife 866-548-7139 for more information about that. But again, during open enrollment, again, November 1st to November 30th, not October, not December, employee can go in there and elect to enroll or increase supplemental life insurance coverage, elect $1 million coverage for the employee, then also to the ELI only requires 5 questions. Look off to the right there. Again, you can enroll online through MetLife's My Benefits portal. Also made available to you, it'd be an enrollment form, Enroll Smart, will be available through the PEBB website. How to apply is a link to the MetLife My Benefits portal. I suggest anybody who has that go there and enroll and sign up for that. Look over their benefits, make sure that they are what they are. I try to look at mine every couple months and stuff just to make sure everything is the way it's supposed to be. And then inside that portal, you can make changes to your account. You can change information there. So again, information through MetLife there. You want to sign up for that portal there and get information through there. If you can't access the portal, which we want people to do, on the PEBB website, you can be able to provide them with an enrollment form. It'll be under the Forms of Publications page of the PEBB website. For life, AD&D, and LTD, there's no change to the rates for 2021. When will an employee receive a rate change, experience a rate change? Again, for supplemental life insurance, could be a change of age bracket, or maybe there was an increase or decrease in the coverage elected. For supplemental AD&D insurance, it could be an increase or decrease of coverage elected. And for the supplemental long-term disability insurance, it could be a wage change or increase or decrease of the benefit waiting period. So again, no change to the rates for 2021. Like my birthday is in June, and I had a change in age this year, the age bracket. My rate doesn't change until January 1st of 2021. So off to the right there, life insurance rate increases due to age, change age brackets, or effective January 1st or January of the following year. As far as enrolling in and making changes to life, AD&D, and LT insurance can be done at any time during the year. Again, and if I do that anytime during the year, again, it's going to require, except for the open enrollment for life insurance, will require approval through the insurance company. For supplemental life and AD&D, to enroll, increase, or decrease the coverage elected, you want to complete the MetLife enrollment change form or visit MetLife's My Benefits portal online. For supplemental long-term disability, to enroll, increase, or decrease coverage elected, complete the long-term disability enrollment change form, and if it's necessary, complete the long-term disability evidence of assurability form. Just remember, any changes outside of the 31 days or original 31 days of eligibility, it may require evidence of assurability. All right, FSA and the DCAP program. All right, for medical FSA and DCAP, PEBB benefits eligible state agencies and higher education institution employees can enroll or re-enroll in medical FSA or the DCAP program. Regardless, you have to re-enroll every year if you wish to participate. Even if the contribution amount remains the same. I do it every year. But in order to enroll, well, I don't do it every year. That's a lie. One year I forgot to do it. And I even work here. I forgot to go do it. December 15th or so, I said, oh man, I can't believe I did it. I had to wait till the following year. So again, in order to enroll, or re-enroll in the medical FSA, you must during open enrollment, even if the contribution amount remains the same. In order to enroll or re-enroll, and complete the NAVIA 2020 open enrollment form, or visit the naviabenefits.com website to enroll or re-enroll in the medical FSA or the DCAP program. One note, I cannot sign up for a high deductible plan and a medical FSA at the same time. So if that situation happens where an employee signs up for both, we're going to notify you as an employer and say, hey, these employers are signing up for both. We're going to give them an opportunity to disenroll or enroll in the medical FSA or re-enroll into the medical FSA to see high deductible plan with HSA. We'll give them to December 31st. If they make no choices before that date, they will be disenrolled from the medical FSA and remain enrolled in the high deductible plan with the HSA. So again, employees sign up for the medical FSA and the CDHP plan. Didn't know the difference. We'll give employees a choice to make changes there. Okay, so at that point there, they can be, if they don't make any changes by December 31st, they will be disenrolled from a medical FSA and remain enrolled in the high deductible plan. The very bottom there, employees may choose to enroll in the DCAP program if they enroll in the high deductible plan. So they can do the DCAP, they can't do the medical FSA. How about contribution limits for 2021? For the FSA program, the minimum contribution remains the same at $240 annually. The maximum annual contribution went up $50, was $2,700 for 2020. For 2021, $2,750, so went up $50. The DCAP program remains the same, $5,000 annually, or if they file separate tax returns, $2,500 each. So again, $5,000 annually for a single person or married couple filing a joint tax return, or $2,500 annually for each married participant filing for separate tax returns. They bring it back to $250 medical FSA CBA contribution for 2021. All right, they negotiated this in September 2018 for represented employees only. You must have an annual rate of pay at $550,004 or less on November 1st. And they enroll in a medical PEBB medical plan that is not a CDHP or an with an HSA plan. The $250 will be distributed in January 2021. Is paid by an employer. No action is required by the employee. And remember, this amount does not count towards the IRS maximum. So if they use maximum for that, it could reach $3,000. Actually, it's $3,050, I believe. No, $3,000 for the medical FSA in 2021. The employee does not have to sign up for a medical FSA to be eligible. They receive a debit card if they don't already have one. So if they want one, they don't have one, you want to contact Navia in order to get one of those. If the employee doesn't want the funds, they don't have to use it. Don't use a card. The funds will be forfeited. What if the employee is enrolled in the CDH plan with the HSA? The employee will not receive the $250 due to IRS rules. The benefit will be forfeited. What if the employee is not enrolled in medical as a subscriber or a dependent? The employee will not receive the $250 and the benefit will be forfeited. So again, enroll in a high deductible plan, not enroll in PEBB medical as a subscriber or a dependent, the employee will not receive the $250. Here's a letter that's sent out to the employees. Kind of give a little bit of information what's going on. Again, this will be, some people will be the second year of this happening. There will be a fax posted on the PERS Pay websites under notice and update section. There will also be an article in October for your benefits newsletter that will be sent to the employees. They are offering webinars this year. Navi is. and offering 2 webinars during the 2020 open enrollment period. So again, November 3rd at 1 p.m., November 19th at 1 p.m. Navia's website, you'll go out there to register for that. Also, in the PEBB's open enrollment webpage, there will be a link for registration there.
So this is Jamie with Outreach and Training. So I do want to say that Larry did a fabulous job there. So I am going to get started on the next section here. So we're going to go right into the 2021 rule changes. So these changes are effective January 1st, unless otherwise noted. There are some things that we had, changes that we had throughout this past year, and then we'll talk a little bit about some changes for employees coming from the PEBB program to the PEBB, and then we'll even cover a update for one of the worksheets here in the next couple of sections. So let's go ahead and get started. So the first one has to do with the non-payment of premiums for employees while they're on approved FMLA. So what happened here is that the termination for non-payment language has been removed from PEBB Policy 19-1A and WAC 182-12-138. So the information is no longer there, which can be translated to the fact that benefits can no longer be terminated for non-payment of the employee contribution while that employee is on approved FMLA. Right, so this one here has to do with paid family medical leave and FMLA. So last year, the Washington paid family medical leave became effective, that program did. And in the WAC 182-12-138, there was a section 1 that contained reference to both Washington PFML and FMLA. So for this year, for 2021, those two sections have been broken up. So now subsection 1 in this WAC will address FMLA and subsection 2 will address PFML separately. And just as a reminder, the Employment Security Department does determine eligibility for PFML. And this next slide coming up is just a reminder on some information that we covered earlier this year, but we wanted to take this opportunity just to throw a refresher out there. So when it comes to PFML, that in itself is not a protected benefit, so it doesn't protect an employee's eligibility for benefits while they're on that leave. In order for their eligibility to be protected, the same way it is with FMLA, this employee on approved Washington paid family medical leave would have to also be approved for FMLA, and that FMLA would have to have at least one day that runs concurrently or overlaps with the Washington paid family medical leave in order for the protection of FMLA to extend to PFML. So they have to touch or be touching. And it's only extending that protection for that period of Washington paid family medical leave, not for every chunk of leave that they're approved for in the future. Now, if the employee is approved for Washington paid family medical leave, but not FMLA, then they do have to have the 8 hours minimum of pay status per month in order to maintain eligibility. And of course, that translates to 5% for higher education. All right, so this next change here has to do with dependent verification. So last year, there was an update to the rule to policy 31-1 that stated that when a marriage certificate is supplied to verify a spouse, we also require the supporting documentation, so that proof that the relationship is still valid. So that would be like a utility bill or some other kind of official documentation showing the employee and spouse's name and a common address, or 2 pieces of mail, same address, both the employee and spouse or partner's names listed. And we had to have that dated within 2 months, that proof did. Well, now, come January 1, 2021, they've extended that. So it can now be dated in the past 6 months rather than the past 2 months. And as a reminder, we cannot verify a spouse or partner with a marriage certificate or certificate only any longer. There used to be that 2-year rule, and that's no longer the case. We have to have that supporting documentation. All right, so this one here has to do with partnerships, partners of a legal union. So we're not talking about Washington State registered domestic partnerships here. We're talking about those partnerships or legal unions from other states or other jurisdictions. So with this, know that once the partner has been verified through the PEBB program and enrolled in benefits, they may only remain enrolled for up to 1 year after they've initially been enrolled in benefits. So at that 1 year point, the PEBB program will terminate the partner's benefits unless the subscriber provides documentation showing that a marriage or a Washington State registered domestic partnership has been entered into. All right, so recertification, dependent children with disabilities. So with PEB policy 36-1, this language has been added in there as well as the WAC listed, the 182-12-260, that recertification of a dependent child with a disability will require renewed proof of disability independence. So know that about 90 days out from the recertification date, the Healthcare Authority or PEB program sends a letter to that subscriber and it says, here's your deadlines, here's exactly what we need from you. So your employees are going to receive notice if they're affected by this, and we'll tell them exactly what they have to send in and exactly when it's due in that letter for recertification. So they will be notified. So enrollment of extended and disabled dependents. So for the addendum 45-2A, that is our special open enrollment matrix, there's language that was already out there in WAC that's now been added to that matrix. So what it is if a special open enrollment event occurs that is due to the enrollment of an extended dependent or dependent with a disability, the change in health plan coverage is going to begin the first day of the month following the later of the event date or the eligibility certification. So the language that's been added is that eligibility certification at the very end. Again, this was already the practice, already existed in WAC. They've just added that language onto the addendum 45-2A, onto that SOE matrix. Right, this one has to do with notifying employees of eligibility. So currently, the way that it works is we get a new employee, and hopefully, everything is running timely. But we notify them of their eligibility on their first day of work, and that's really how it's supposed to work. You have your first day. We tell you, hey, you are not eligible for benefits. Here's your notification of that determination, and it contains all the information that they need. Well, when they're eligible for benefits, they have that 31-day eligibility window to elect coverage and to supply any dependent verification that's required. But what happens when we get a little bit behind or we're not notified timely that we even have a new hire, or there's just various things that can kind of get in the way of that 31-day window and that timely notification? Well, currently the way it works is if something happens and we can't notify them timely, let's say we end up notifying them on day 28 of their 31-day window. Well, in that case, they only have 3 days left to complete their forms and supply all of that DV, that dependent verification. So what this change is doing is it's accounting for those situations, and the rule is going to state for January 1 of 2021 is that eligible employees must have no less than 10 calendar days after the date of notification. So if we notify them late on, say, day 28, starting the very next day, they have 10 calendar days left. So they don't have 3 now. They have an extra 10 to give them the ability to really sift through those benefits and elect coverages that are going to best suit them rather than having to rush through it. So know that if the employee is notified outside of their 31-day window, that's a little bit of a different situation, which would need to go through the error correction process. But as long as they're notified within their 31-day window, then if they're notified at a time when they don't have that 10 calendar days left, we would then extend that 10 calendar days for them. So let's take a look at how that actually affects the timeline for when forms are due. I have an example coming up for you. And just as a note, this doesn't change the date of eligibility or the date when coverage begins. This is simply giving them more time to elect those benefits, supply those forms in DV. So here we have an employee whose first day of work is January 4th. So that's their date of eligibility, and they're eligible for benefits. Well, based on that January 4th date, they have 31 days after January 4th to supply the dependent verification and forms, which is February 4th. Well, let's say things get busy or we don't, we're not able to notify them timely, and we end up notifying this employee of their eligibility on day 28, which is February 1st. But with this new rule, that employee now has 10 days starting the day after February 1st to supply those forms in DV. All right, hopefully that example helped for you. Switching gears here, now we're going to talk a little bit about emergency hours. So currently when we're factoring eligibility, if you look at the worksheets, it specifically states that emergency hours must be approved by the PEBB program, otherwise they're excluded in determining eligibility. Well, as you all know, we've been in the middle of COVID for the past several months, and there's been rules and different practices that have changed as a result of that. So we've learned a lot during this time, and one of those changes is that they've updated WAC 182-12-114 to state that any hours worked in direct response to a governor-declared emergency, those hours are not excludable and must be included in determining eligibility. So they've separated these governor-declared emergency hours from regular emergency hours. All right, special open enrollment clarification. So an SOE event must be something other than an employee gaining initial eligibility or regaining eligibility. If you all have a really great memories, you might remember this slide from last year. It's very similar. So last year, the only section we had updated was that the SOE event must be something other than an employee gaining initial eligibility. So we've got a new hire, a new employee, they're brand new, newly eligible. They get a 31-day window. They don't get 60 days to elect their benefits. Well, now they've also added employees regaining eligibility. These employees also only get 31 days to elect their benefits, submit their forms in DV. Neither of these examples here, the initial eligibility or regaining, is considered an SOE event. They do not get the 60-day window. Okay, so next one here has to do with special open enrollment event number 12. So if you went out to the SOE matrix right now, you would see that number 12 is specifically talking about Medicaid and CHIP. So employees cannot waive PEBB medical coverage for the following events. So they cannot waive for Medicaid for they or themselves enrolling or losing eligibility for Medicaid, or for CHIP. So either of those scenarios. Now there are other changes that they can make, and they're listed in the special open enrollment matrix, but the employee waiving PEBB medical coverage for either of those events is not going to be one of them. And that's also listed in WAC 182-12-128 for the upcoming January 1, 2021 rules. So this is not a big change. With the National Medical Support Notice, it has its own WAC. Its WAC is actually 182-12-263, and it is specific to what changes can be made and what documentation is required, that sort of thing, in regard to the National Medical Support Notice. What the change that it's listing here is about is just that they've added a section in WAC 12-262. So there's an A, B, C, D. One of them is open enrollment, one of them is special open enrollment, and now you have section D that just lists National Medical Support Notice and provides the link to the WAC 12-263. So not a big change here. It's just a new mention of it in another WAC. This one has to do with continuation coverage, unpaid leave. So as you know, the PEBB program administers the continuation coverage benefits, but it's a pretty big update. So we want to make sure that you all are aware of this in case you do have these kinds of conversations with your employees. So with this one, language is being added to WAC 12-142 and 12-133. And it states that if an employee elects to continue life insurance or accidental death and dismemberment insurance, they must also continue both basic life and both basic AD&D insurance. And that's because the premium for the basic life and basic AD&D, it's one premium. It's like $3 and some change. They're not split up into two separate premiums for those basic coverages. So if they continue one, they have to continue both. All right, so we split this section up because the next 3 slides are specific to employees moving from the PEBB program, which is the School Employees Benefits Board, to the PEBB program. So last year, January 1 of 2021, I'm sure many of you are aware of this. You have employees who were likely impacted, even yourselves maybe, but the Healthcare Authority's PEBB program went live January 1st. And so now we have employees leaving PEBB, going to PEBB, and then coming back and forth. And that's what these rules are going to speak on. So for employees who are leaving the PEBB program, coming over to the PEBB program, dependent verification is not going to be required when that employee is requesting to enroll eligible dependents who were previously verified under the PEBB program. So I'm going to tell you a little bit about this one. It's not an automatic process. So if you have an employee and you know that they're coming from a K through 12 school district, educational service district, and they're adding dependents, you can have this conversation with them. Or if the employee tells you, hey, I'm coming from the PEBB program from the school district, do I need to re-verify my dependents now that I'm coming to PEBB? And what you can do as the administrative staff is send a fuse message to outreach and training and say, hey, I've got this employee. They're telling me, or I know that they're coming from the PEBB program and that they had dependents who were previously verified. Can you take a look in that other system and see if this employee needs to supply dependent verification or not? And our outreach and training customer service team will take a look at that data, that information in there on the verification, and determine whether or not anything new needs to be supplied, or whether or not they can just go ahead and enroll their dependents and transfer that verification over. So again, it's not automatic. If this pops up, definitely send us a fuse message. And if there's any changes in how that process is going to work, we'll absolutely let you know. We'll communicate that with you. All right, next one, same situation. We've got an employee leaving the PEBB program, coming over to our organization with PEBB. For those employees, if they currently have a certified disabled dependent child who is enrolled in PEBB health plan coverage, they do not have to supply the PEBB certification of a child with a disability form when they come on to PEBB coverage. They do, however, have to supply the PEBB declaration of tax status form. They submit that, of course, to their employer. And their recertification date, it's going to be the same date that it would have been had they stayed with the PEBB coverage. And of course, they'll be notified. They're going to get that letter about 90 days out, notifying them of their recertification date coming up and what documents that they need to supply. And this next slide is virtually the same. It just has to do with extended dependent children. So we've got, again, an employee leaving the PEBB program, coming over to PEBB. If they've got an extended dependent child who's currently certified and enrolled in PEBB health plan coverage, they don't have to supply that PEBB extended dependent certification form and valid court order. They do, however, have to submit the PEBB declaration of tax status form if required to their employer. And their recertification date is going to be the same, just based on whatever that recertification date would have been had they stayed with the PEBB health plan coverage, and we will notify them when that date is coming up. Okay, that's it for that section. Now we've got the A5 worksheet revision. So this one here is not a change for January 1. This is current. So back in August, a GovDelivery message went out that stated that there had been an update to the understanding of transfer employees and that there had been changes made to the A5 worksheet. So the reason we're bringing this up is because we've had quite a few questions over it, and we haven't had a webinar since this took effect to explain how this works. So I'm going to take that opportunity in the next few slides to hopefully clarify that. All right, so the revision to the A5 worksheet, what it's attempting to do is clarify when an employee is considered a transfer. So in order to understand that, we also have to understand what a break in PEBB coverage is. So a break in PEB coverage is 1 month or more in which the employee does not receive the employer contribution toward PEB benefits. So maybe I'm enrolled in October in benefits, and then for whatever reason, my benefits end the last day of October, and the entire month of November, I don't have coverage, and maybe I end up picking up coverage in December or January. That would be considered a 1 month or more break in PEB coverage. So let's take a look at how we use that information to actually determine when an employee is considered a transfer. Fortunately, we have some pretty good examples coming up for you also. Here we go. Okay, so the first example, I'm already going to tell you the answer here. It's employee is not a transfer. That's this scenario, so no surprises. We already know the end result. So November 13th, we have an employee who has their last day of work. They are terminating employment with our organization. So the last day of benefits for that employee is the last day of November. This is no different from how we currently process things. Whenever your last day of eligibility is, your benefits end the last day of that month. Now, let's say that this employee goes to a new organization and a new PEB organization, and their benefits begin and their date of eligibility is December 16th. That's their first day of work. Well, because it's not on or before the first working day of the month, in this case it's December 16th, their coverage would be effective January 1st, first of the following month, and they would have a break in PEB coverage. And this is because their first day of work or their date of eligibility did not land on the first day or first working day of the month. It was after that. For this employee, they would not be considered a transfer. They would receive new PEB elections and must receive a new A-Series worksheet notifying them of their eligibility or ineligibility. All right, so let's take a look at the opposite scenario. Example 2, this employee is a transfer. So same scenario here. We have an employee whose last day of work with their employer is November 13th, so benefits end November 30th. No surprise there. This employee starts working with a new PEB organization on December 1st as their first day of work, as their date of eligibility. We've determined that they're eligible for benefits with our new organization. So because it is on or before the first working day of the month, benefits are also effective that day. So this employee is considered a transfer, does not receive new elections, and does not have a break in coverage. So if their first day of work, date of eligibility, is after the first working day of the month, they have a break in PEB coverage, they're not a transfer. So if you want your employees to be considered a transfer, their first day of work with your organization, if they're coming from another PEB org, needs to be on or before that first working day of the month. Otherwise, they're going to have a break in coverage. So hopefully to simplify the idea of how that works with you, you can use the 2020, whatever year it is, the first working day of the month, effective date worksheet. So we do update this every year. The 2021 will come out in January. It's available on the PERS Pay website in the quick reference guide section. And we use this when determining when benefits begin. So we have that first day of work, and then we have the effective date based on when their first day of work or date of eligibility was. There's also been updated information added to that A5 worksheet. It's out there. The best thing I can point you toward is when you open that A5 to really understand this, look at the examples that are provided on it. That really helped clarify how this worked for me. So definitely take a look at the examples, not just the rule that's listed in there. So let's take a look at November here. So if we have an employee who's coming from another PEB employer to our employer, our higher ed institution, and their first day of work or date of eligibility is November 1st or November 2nd, then they would be considered a transfer because it's on or before the first working day of the month. But if their first working day or date of eligibility is November 3rd or later, then they would not be considered a transfer. Their benefits would begin first of the next month. So that's how you can use this document to help you through this determining these transfers. Larry, am I good to go, or is there anything we should address before I move forward?
Look good on my end. Doing a great
Perfect.
job.
Thank you, Larry. All right, so this next section here has to do with reattestation. So hopefully many of us are familiar with the spouse or state registered domestic partner coverage premium surcharge reattestation requirement that occurs for many employees every annual open enrollment. I will attempt not to say that entire surcharge name again during this presentation for your own sake, as well as mine. All right, so for those employees who are required to attest, they're going to be notified. They're going to receive letters from the healthcare authority. So the first one that'll come out will come out at the end of October. We'll be mailing it out to the address that we have for them on file, and it'll say, hey, you are one of the lucky winners. No, I'm just kidding. It'll say, hey, you have to reattest to the spousal surcharge. Otherwise, you're going to default and you'll end up having to pay that $50 surcharge per month for January 1 of 2021. So very important that they pay attention to that and follow the steps that it's going to provide for them to reattest. It'll tell them that they have from November 1st to November 30th to reattest. But of course, if they don't, this is the only exception that we have when it comes to open enrollment changes. If they don't do it during annual open enrollment, they'll receive another letter at the beginning of December that says, hey, you didn't do this really important reattestation during open enrollment. We need you to do that. And now you have until December 31st. Otherwise, you're going to default and incur that spousal surcharge. If they still fail to reattest, then they'll receive a third letter in January that states, hey there, you didn't reattest, so you've now incurred that $50 surcharge for the plan year of 2021, and it'll include their appeals rights. So employees who do need to reattest, they can do so via My Account or on paper form. Those employees in Workday, I believe they do that in Workday. And again, they have essentially from November 1st to December 31st to do so, to do that reattestation. So not attesting will result in that $50 surcharge for the plan year of 2021. So the surcharge is going to remain in effect for 2021 for those who do incur it, unless they have a special open enrollment event that allows them to make a change to that attestation, or if the spouse or state registered domestic partner's employer-based group medical insurance experience a change that allows them to reattest. So here's a little bit about the default process on your end. So employees who are required to reattest to that surcharge, they're going to show a default in Pay 1 prior to open enrollment. So it's usually the last couple of days of October that this goes into effect. And what you'll notice is on the A43 screen for the spouse, where a number, the yes, no, or the number is entered under the attestation, it'll say a D. So it'll be in there for default, and it'll flip to default if they don't reattest for January or on January 1st. So you can either go in and look individually at every single one of your employees to see which this applies to. I would not recommend that. That's mostly a joke. Or for those of you with Pay 1 access, you can actually log into your own PEBB My accounts. I believe Larry talked about this earlier. And you can click on the subscriber SOI lookup button. We have a screenshot here on the screen if you're able to look at that. And you can click on the attestations report and pull that up for your organization, and it'll show you everybody whose attestation has flipped to a D. And so if you're able, you can reach out to them yourself and say, hey, I noticed that you need to go ahead and do this, and let them know how to go through that process. If you don't have access to Pay 1 and you're not able to generate one of these reports, you can send us a fuse request and we'll send you that attestations report back. All right, so some annual open enrollment reminders. This may be new information for some of you, but for most of you, this is the same kind of stuff that we cover at the end of every pre-open enrollment webinar. So here we go. So dependent verification is required at the same time as other enrollment forms. So not, they don't have extended deadlines for their dependent verification. So when we have a newly eligible employee, they must supply their forms and any applicable dependent verification no later than 31 days after their date of eligibility. For special open enrollment events, it's no later than 60 days after that event. And during annual open enrollment, it's no earlier than November 1st and no later than November 30th for those forms independent verification. And I'm really happy to say that November 30th is on a Monday. I don't know if Larry mentioned this earlier, I didn't catch it, but last year it was on a Saturday or Sunday, and of course that's never fun. So this year we've got it on a Monday, which is really nice. And, if you're able, definitely follow up with your employees if they are submitting enrollment forms and adding dependents on there, but then not supplying that dependent verification, or if they're supplying dependent verification and the document is invalid, or maybe they haven't supplied everything that they need to. So just some information about the high deductible health plan paired with the health savings account. So for employees who are changing from that high deductible plan with the HSA and they're going to enroll in a traditional plan for 2021, if they are making any automatic payroll deductions or direct contributions to health equity, they need to stop those. It's not automatically going to stop for them. So they'll need to submit that payroll deduction change form to you or stop those contributions that are going direct to health equity from their accounts. And employees are not eligible for the health savings account if they or their spouse is enrolling in a medical FSA for 2021, unless the medical FSA is made limited purpose. And just to note, PEBB's medical FSA cannot be made limited purpose. So for employees who are currently age 65 or older or will be turning 65 in 2021, we highly discourage them from enrolling in the high deductible health plans, the CDHP, with the health savings accounts without seeking professional tax advice first. So we always want to forward them to their professional tax advisor, and they're also welcome to contact Health Equity as well if they have some questions. But this is because Medicare can be ruled retroactively, which can cause some issues with the IRS once they're eligible for Medicare and if they're enrolling or contributing to an HSA. So employees may not enroll or re-enroll into a medical FSA if the employee or their spouse or state registered domestic partner is enrolled in a high deductible plan for the 2021 year, or if the employee changes to a high deductible plan for 2021. So for employees who have a medical FSA this year in 2020, who are electing that high deductible plan for 2021, just something to note is that if they don't use all their funds by December 31st, and they have funds remaining into the 2021 plan year, they have that extension up until March to utilize those funds. If that occurs, there won't be any contributions made into their HSA account for their new health plan until April 1st of 2021, but it's like catch up. They'll receive the same amount of funds. They're just not going to be deposited until April 1st or that month of April. Just a reminder here about employees who are adding newly born or adopted children during the month of December. So we suggest that you key those newborns or children as soon as possible. So when we have employees who are making changes during annual open enrollment, maybe plan changes, things like that, it can cause issues and delays with the carrier when they're making multiple changes, and we're also assisting with changes on our end. So definitely do that as soon as possible. So if there's any kind of thing that catches them up, we can get that lined out in advance of the new year. And just as a reminder, the effective date that you're going to enter into Pay 1 for coverage for that child is going to be that date of birth, date of adoption, or date that they assumed financial responsibility for the child. If you don't have the date, or you're unsure of the date, or you're having issues entering it, please do not enter an incorrect date. Just contact us via Fuse and let us know that you're having difficulties, and we'll help you through it. It's much, much more difficult to go in and make a correction than it is to just help you with it. Fuse and phones. So open enrollment is busy. I don't know if you've all noticed, I'm sure many of you have, but we're already getting there. It's been an interesting year for us. And just know that we are working through the fuses. We process them in order received. So if you haven't received a response yet, you will. Even Larry and myself are helping out with those, so we're trying to do what we can. But know that you're our number one priority. We're doing everything that we can, and you will get an answer to your question. So please let your employees know once you've sent those messages up, and that they'll receive a response as soon as you could possibly get it back to them. But we are working, and we're dedicated to answering those fuses. So know that if you have a fuse that's open and it's been out there for a little bit, if you were to go back into that fuse and send another one to say, hey, is there any sort of status on this? How's it going? Can I get an update? Unfortunately, with the way that the fuse system works, that's going to put you into the back of the queue because they're worked in order received. So if you can avoid sending that, hey, just want to check on the status message, please do, because it's gonna give you a longer wait time. Also, try to avoid sending the same fuse twice. We've been getting a lot of duplicates, and sometimes we can end up having two different people trying to process the same thing. Even if it's already been completed, they're still going through the motions of attempting to do that, only to find out that it's already been done. So please only send the one fuse message for that one case. And if you can avoid sending anything just unnecessarily that bogs the system down, that would be great as well. And I probably talked a lot more on that slide than I really needed to. All right, moving on. Okay, so agency resources. So for you all, we do have agency resources. So we've got our outreach and training phone number. That is a phone number that's there when you have an emergency. So it's the 1-800-700-1555 number. You're going to get our customer service and outreach and training. And that number is specific to you as employers who handle PEB benefits. That's not a phone number that we share with employees. Same goes for the PersPay website, all kinds of resources there for you. We've got Pay One manuals to help you through anything that you get stuck with, and then all other kinds of resources, administration booklets, eligibility manuals, they're all out there. Also, you have the Fuse system to contact us with, and you have the, the additional resources. So again, please contact us with your employees' questions. Do not provide these resources to your employees. So the PEB division outreach and training number, again, is for you all to contact us with your questions and your employees' questions. The PEB division customer service line, it's the 1-800-200-1004 number. That one is for those who are either looking into enrolling in COBRA continuation coverage or retiree coverage, or those who are currently enrolled. So if they have those specific types of coverage questions, they can definitely contact that line. But if they have questions as an employee, unfortunately, our PEB customer service line does not have access to employee information, and they can't assist with that either. So that employee is just going to end up on hold, waiting, getting a hold of somebody only to be directed back to you. So as much as we can, we try to deter them from calling that number. And also, please don't share our personal email addresses or phone numbers with employees either. What we do have out there for employees this year are the PEB website, which contains the PEB Open Enrollment webpage. That webpage already has information posted on all of the changes coming up for January 1, as well as that new UMP Select plan. I know we had quite a few questions on that earlier, so definitely go out and check out the PEB Open Enrollment page and that virtual benefits fair. That is going to have those booths where you can go and learn about the new plans. So that's out there for you all as well as your employees. They also have the individual plan websites and the plan contact information. They, of course, can contact their current plan with the phone number on the back of their ID card as well. They have Navia Benefit Solutions contact info, health equity. All of this is available on the PEB website. And the MetLife customer service to reach out to, as well as the Smart Health Wellness program. So all of these resources, employees can reach out to them directly. So what employees should be contacting those plans with are questions like their benefits, their ID cards, claims, checking to see what providers are in network, choosing a doctor or dentist, and if they have any questions over prescriptions. We definitely don't expect them to come to you with those questions, and those aren't things that we can help with either, unfortunately. They do need to go directly to the plan for that. But what they should contact you with are things like questions on eligibility or changes in eligibility. If they have questions about enrolling, their enrollment forms, or dependent verification, premium surcharge questions, if they're having difficulty finding forms. Just as a note, all of our forms are available both on the PersPay website for you as the PEB administrators or employers, and in the forms and publications section of the PEB website for employees. So employees have access to all of those enrollment forms as well. They should also reach out to you if they have questions about adding or removing dependents, questions about their life and long-term disability insurance when it comes to eligibility for that coverage and enrollment. If they have specific questions for life, of course, they can contact MetLife directly. LTD, we have that administration manual out there, or you can send your questions via Fuse, and any questions that they have on payroll deduction. So last year we had that big change for the school employees board coming on board, and we updated the entire web page. So it still looks the same this year. We've got our public employees section over there on the left. School employees is in the middle. We've got our retiree section on the right-hand side of the web page. And then if you scroll down to the bottom, there's a continuation coverage section, and there's both a PEBB continuation coverage page and a SEB. And right now, if you can see this little family up in the top of the screenshot of the web page, now it has the open enrollment web page for PEBB and the open enrollment web page for SEB. So I do want to take you out there real quick just to take a look at the open enrollment page and the virtual benefits fair page. So I'm going to clear off of this, and I'm going to open up, oh gosh, I've got a lot going on here. Okay, which one? All right, so I'm going to actually show you how to get to it. Oh, wrong web page, of course. Okay, so at the top of the screen here, I've got the web link. It's www.hca.wa.gov/employee-retiree-benefits. So that's our PEBB webpage. This is resources for you, resources for your employees. So if you can see here in the top of the screen, we have open enrollment for SEB and open enrollment for PEBB. But I'm actually going to click on public employees just so that I know that every link I'm clicking on is taking me directly to the PEBB employee information. It's really easy to get those two at the top confused on that first page. So at the top of the PEBB webpage for employees is My Account. We've got that green button off to the right-hand upper corner. And in the middle of the screen, we now have PEBB Open Enrollment and Virtual Benefits Fair for PEBB. So I'm going to open the Virtual Benefits Fair in a separate tab, and I'm going to click on Open Enrollment. All right, so this is just a quick overview for you, but we have a menu here at the top, and if you click on any of these items, it's going to bounce you down to that section of the web page. But we have 2021 benefits and plan changes. Where do I find changes that affect me? What changes can I make, and how do I make those changes? So they have drop downs with information. It automatically goes straight to the public employees tab. So it talks a little bit about premiums and benefit information there. They've got their 2021 medical plan premiums, life LTD premiums. They can compare the different plans, see what plans are available to them. So that plan availability by county. They can look at the summaries of benefits, find providers. And then here toward the bottom, we have a section titled Newsletters, Benefit Fairs, and Webinars. So I'm going to do the drop down for Facebook Live. Of course, Benefits Fair is just going to take them to let them know that there aren't any in-person fairs, and then it's going to take them to the virtual Benefits Fair. So for Facebook Live, there is that event that Larry talked about earlier on October 14th at 4 p.m. We tested it out the other day, and we believe you don't actually have to log into Facebook to attend that. You just have to make sure you click off of the part that wants you to log in. It says, it gives you the option to say not now. So if it wants you to log in, you can say not now, and then it'll let you scroll the HCA's Facebook webpage and attend that Facebook Live event. So webinars here is the next one I want to click on. I'm actually going to go ahead and open that web link up. And we've got all of these webinars. So if there's not a specific carrier listed, that's because they didn't agree to do a webinar. But everybody that is doing webinars is located on this page. So we've got Kaiser, we've got UMP with webinars taking place in November and October with the registration links there. Willamette is doing a webinar, as well as the NAVIA for the Medical Flexible Spending Arrangement Independent Care Assistance Program and long-term disability insurance. So they can come here to register for those webinars. Oh, and look at this. So there was a question earlier that asked about recorded presentations. So I stand corrected. If you are unable to attend a live webinar, watch a recorded on-demand presentation for those NAVIA webinars. So here it is for you. Okay. So that's it for the OE page. You could definitely come back to this page yourself, delve a little deeper. I'm going to click over to the Virtual Benefits Fair. So we've got Dave right here up front and center. You can watch his welcome message. And then off to the right-hand side, there's a table, and it provides news, newsletters for PEBB and SEB. And then we've got Virtual Benefits Fair PEBB for employees. So I'm going to click on for employees. And then it gives us 3 options for the benefits: medical, dental, and additional. Additional is where you're going to find things like long-term disability, life insurance, and so on. I'm going to click on medical benefits. And we have 3 more sections for the booths. So then you can go in, visit the booths, and learn about all of the plans as well as the new plans coming up for 2021. Or I guess I should correct that, the new plan coming up for 2021. Okay, and that's it for that quick review. All right, everyone. Thank you all again so much for attending. I'm going to go ahead and end this webinar. Thank you all so much again. Have a good one.